Hello, my name is Wendy Lyon and I'm the Head of Staff Partnerships for Oxleas and I'm based at Pinewood House. I'm visiting the recently opened Acorns Children's Centre at Queen Mary's Hospital in Sidcup, where I will be meeting our Chief Executive Ben Travis to talk to him about the Trust priorities for the coming year. As we go into the new year, can you say what you and your management team are going to be concentrating on?
So we're really going to be focusing on our 4 trust priorities, which are improving quality, having a engaged and skilled workforce, a sustainable organisation, and also working in partnership. In terms of quality, everyone will know we had a major CQC inspection, and whilst they found lots and lots of fantastic things about the trust, so 58 of the 70 ratings we got were good or better, they also identified a few areas where we need to improve. So the second area being workforce, where we do have more vacancies than we would want, so we're doing a huge amount to see can we recruit more people into the trust and what more can we do to get people to stay when they do come into the trust. And I do recognise that it is probably the greatest challenge we have at the moment. The third area is around the money. And like it or not, the money is unfortunately quite important, and I'm sure many of you will have read the challenges of the public sector at the moment, challenges of local authorities, and we're also in a difficult position as well. However, we are just about living within our means at the moment. If we hadn't had a couple of the CQC issues, we would be absolutely on our plan, which is a really, really tremendous achievement given that it's a tough plan. And the fourth area is around working in partnership. So we're very involved in the work across South East London to come up with a plan for the future for the NHS. But we're also doing some work with South West London, St George's and SLAM around are there things the 3 of our organisations could do together.
Ben, what do you think 2017 will bring for Oxleas?
I think the one certain thing is it's going to be a busy year ahead. We are looking forward to welcoming the CQC back, probably February, March, April time, and look forward to them coming and having another look at our services and hopefully concluding that we are a good organisation. We're also going to be launching a major quality improvement programme across the Trust, probably from April, May time onwards, and the purpose of that is to really see how can we all of our services, all of our teams have more of a framework in which we can make improvements day in, day out. And you'll be hearing a lot more about that over the coming months. And the third thing that we're working on for next year is we're looking at the possibility of moving to borough service directorates. So our older people's mental health services, our adult mental health service, and learning disability service, and also our adult community services, looking at all of those services and thinking about creating a Greenwich service for adults, a Bexley service for adults, and a Bromley service for adults. And the intention there is about really trying to integrate mental health and physical health more than we have done so far.
Ben, what do you think worries staff the most at the moment?
All of our staff want to do a great job for the patients that they're caring for. And I think what worries people is the thought that they might not be able to do a really fantastic job for them. And I think that's really might be because in some teams we do struggle with recruiting and retaining staff.
And what do you think the biggest issues facing Oxes is at the moment?
I think I'd highlight 2. First one is around recruitment and retention. I've talked a bit about that already. And the second one is the real financial pressure that the whole of the public sector is under at the moment, and the challenges of trying to deliver really high quality services, managing additional demand and additional expectations when the resources are shrinking, and trying to find a way through that is incredibly difficult. So I think a lot of this is around working in different ways, trying to form new partnerships, and coming at issues from a slightly different perspective, but I do recognise it's not always easy.
What is the board doing to improve lives for staff?
The key things, I've talked a bit about what we're doing around recruitment. Another bit that we need to do more on is around flexible working, to see how do we make sure that people really want to stay working with us. And obviously the training that we offer is really, really critical to helping staff feel they can improve and deliver the best care possible.
And I just want to say thank you for today. It's been interesting to hear your views, and we look forward to seeing them put in practice.
Well, thank you, Wendy, and I also just want to say thank you very much to all of our staff for the huge amount that you put in delivering really fantastic care to our patients. And don't forget, when we look at what our patients say about the services you provide, in 94% of cases, people say that what you have provided to them has improved their lives.